These are the materials you'll need, but don't forget a towel. H6IV. Hand hygiene, 60-second assessment, assessing for airway, breathing, circulation, and safety of the room. ID your patient. V for check the vital signs. Hand hygiene. Don gloves. Place a towel underneath the patient to collect the drainage from the irrigation. Remove the bandage without touching the wound. Ball up the bandage into your glove. Hand hygiene. Assess the wound for granulation, tissue percentage, color, odor, drainage, the peri-wound's condition. Measure the wound without touching the wound, and then measure the depth by rolling a Q-tip into the deepest part of the wound at a diagonal and then measuring it against the measuring tape. Hand hygiene. For this next part, you don't need gloves, but you'll need gloves to irrigate the wound. So check the label of the irrigant and then lip the container if it's already open and hold the container by the label. Pour the irrigant in and be sure to hold the syringe only by the designated area. Irrigate the wound, holding the syringe at 2 centimeters away from the wound and being sure not to get the top part, the peri-wound area above the wound. This is an excellent stopping point for you to reposition the patient before you get your sterile field or your gloves on so that the wound is facing upward. Set up your sterile field. Open up the bowl like a banana, like you're peeling a banana, holding it by the paper side. Check the solution, lip it if you need to. Pour it in from at most 4 inches away from the bowl. Holding your thumbs, holding the packages with your thumbs up. Pop your materials onto the sterile field. So you'll need 3 packages of gauze, and then a package of Q-tips, and then 1 combine pad. I guess it depends on the order too. But at minimum, you'll need 2 packages of gauze pads, the 4x4s. Don the sterile gloves, being sure to touch the first glove by only the inside of the glove. And then you grab the second one by the cuff. And be sure to put these on with your gloved hand having its thumb out. Get your supplies ready, kind of spread out your gauze pads and get them all ready. For the first gauze pad, you'll want to tent it by putting all the corners together, and then you just swipe it one time and making sure that your gloves don't touch the patient at all. Okay, now take 1 gauze pad, open it up, and place it into the bowl of sterile water or whatever it is that you're supposed to pack it with. Squeeze out the excess moisture, open it all the way back up, and then loosely put it into the palm of your hand, leaving a tip out. Then grab a Q-tip. Drop down your gauze pads, being sure not to touch the gauze pad after it touches the patient. but then you can touch the top of the combine pad. Tape it off. Name, date, time. And hygiene. Clean up your supplies. Get the patient comfortable. Put the bed down to the lowest setting. Call bell. Make sure the patient has the call bell. Hand hygiene before you leave the room and document.